Everyone, I'd like to introduce you to Robert Dunne, who is our Chief COVID-19 Medical Consultant for the City of Detroit. We're also pleased that he has ties to two of our cultural center institutions, both Wayne State University and the University of Michigan. He is an emergency room doctor, and I have to also say he has been so kind with his time with Midtown Detroit Inc. and with NSF, providing support throughout this entire process of trying to guide us in the right way on the reopening plan for the city of Detroit. Dr. Dunne, take it away.
All right, well, thanks. I know we've had a long morning with everybody so far, but to me, this has been absolutely great. Many of the people here have been great partners for the city. MIOSHA has been essential in helping us, NSF. As everyone knows, we dove into this in Detroit, unfortunately, very early. Detroit had the highest case numbers and highest number of deaths per 100,000 population of any city in the first wave. And that really stressed us, stressed our resources. And we already had a pretty good team. I'd say one of the things that was a little frustrating about the pandemic as a whole, as someone who's been involved in preparedness since the 90s, we've been talking pandemics and drilling pandemics since the 2004 SARS outbreak. And a lot of those plans turned out to be just pieces of paper, unfortunately, from a lot of different systems. So we had to build a team that used some of our regular relationships. I'm very involved in public safety. My kind of traditional job in the city has been the public safety medical director, working with first responders. And I would work with the health department on research and social determinants of health and things like that. We'd certainly done a number of public health response projects in the past. Many of you remember the hepatitis A outbreak. So we were very involved in data gathering and vaccination for that. But we really spun up a great team fast, including public safety, the Detroit Health Department, especially environmental health, who was just terrific for us. And we worked with the health systems and the university. Many people remember that one of the first challenges we had here was we really needed some testing. The city spun up their own testing because that was the only way we were going to get it. Initially, with partnering with Wayne State and a number of other labs and setting up the state fairgrounds with some of the health systems, and then working with Abbott. We were the first site in the country that was using the Abbott ID Now product. Literally, we sent someone in vans to Chicago to drive the stuff back so we could start using it because we needed it for patient care. We needed it for employees. As we moved through that, we also quickly realized that not just our first responders, but there are so many essential services. So we had to kind of figure out a way to keep some things open or to open back up some things very early in the pandemic when there was very little guidance or conflicting guidance. Everyone kind of remembers that. And we reached out to a lot of partners to help with that. And we kind of just treated everybody, regardless of what job they had, as a healthcare worker and kind of followed the healthcare worker guidance for that. As things moved ahead and we got guidance from MIOSHA and other leaders, we moved to more refined plans. But still, I think everybody today pointed out to some of the key things for reopening. One, don't get people in the workplace if they don't need to be there. If you can do anything to keep people out of a crowded situation, absolutely essential. Particularly our IT was great at getting resources to people, improving VPN access, doing things to keep people out. And that is still a core part of what we're doing in the city of Detroit, is making sure that anyone that needs to be, that has to do something in a city building, or even contractors working for the city, are absolutely have to be there. And once they're there, we're doing, I think, what everyone else is doing in terms of screening. A couple things I just want to point out that I think have been very positive for us and our employees is we've had an excellent team of people, particularly using our human resources for tracking our folks that are in quarantine and isolation, regardless of how they got exposed or how they got sick. They're getting a call every day from an HR rep, making sure they're okay. We can help facilitate medical care. We've literally sent, a community paramedic to people's homes at times to check on them. And I think that, especially during the scariest times, was something that was really reassuring for all the city employees. And that was something that I count as a great win. The other thing, we still have a big enough medical team that we're able to look at every single exposure and every single positive case individually. We jumpstart contact tracing, just like the gentleman was talking about at CCS. We're starting that in-house, working with the health department. As people know, our employees come from all over the metro area, so their health department of record, where they live, is doing some contact tracing. But as an employer, we really feel that's important as well to kind of start that immediately. We have the ability to do that 7 days a week. When we were very busy, we had a team of emergency medical services, paramedic supervisors that actually would get out, do some interviews, get the information that the health departments need, but also help to reassure our employees that we're focused on that. Someone talked about misinformation and just lack of information, and I still think that's a challenge. We still get a lot of questions about people like, I drove through a town where there was a lot of COVID. What do I have to do? And there are some literally very very nervous folks that we're trying to work with and trying to stay focused on, and learning from all the new science that's out there. That is the other kind of ongoing challenge, is to keep reevaluating everything that we're doing. And I think that keeping up is probably one of the hardest things. Someone mentioned making sure you read every word in the executive orders. I cannot emphasize that enough. It sounds boring, but it's a really important thing to do to help understand it yourself. And if you're not sure what they say, reach out, ask questions, try and find out, whether it's working with local authorities. Our health department director, Denise Fair, our chief health officer, has been absolutely vital to help people interpret the orders. And she's got Dr. Khaldun, who was our former director, on speed dial. So if you need interpretation from the state, the health department can help with that as well. So I know we've had kind of a long day, and there were just a couple other things I wanted to mention. That the city has been fairly innovative at helping businesses with things like street closures, expanding restaurants and things like that. And that has also taken a group from the health department, public safety, fire inspectors to make that happen. And I really, I'd worked part-time for the city for a number of years, again, just focusing on first responders. Pretty happy with what the administration had done. But as someone who got extremely involved in this, I was impressed by how fast things could go. I think anyone who's worked the city of Detroit sometimes thinks that things can take a very long time to happen, but the nimbleness that the city was able to show in this definitely impressed me as someone who'd kind of been involved as an insider. And there's more of that going on right now. I mean, Detroit is clearly working with local businesses to try and find the best ways to help them, and also getting ready for the rollout of the vaccine. People asked some questions about that, and I know Sean mentioned some things, and I think he's absolutely right. It's going to take quite a while before we have large amounts really available for the general public, but vulnerable populations and healthcare workers and other responders are kind of getting targeted in that first wave. And many of you who helped with things like using your parking lot for something, what is something that may well be needed for the vaccination program. We did, for those of you who remember the last pandemic, which was nothing quite like this, a lot smaller scale, 2009, 2010, we were doing drive-through vaccination with the City of Detroit Health Department, County Health Department, for a lot of people during the H1N1 pandemic, and we're reusing those plans today, but scaling them up. So I think as we move forward, yes, there is some light, but I think everyone's very concerned now that the cases are going up steadily. I think everyone showed some of that today, and that it's stressing our health systems across the state more than it's stressing our health systems in the city proper right now. But remember, those are all part of larger systems. So, anything anyone can do for yourself, for your employees to stay healthy is going to benefit everybody. And I think that's something I just want to end on, a message I give every day to our employees and the first responders I work with.